from a president looking for a quick escape from this crisis. Nick Bryant, BBC News, New York.
Let's get more now on what we learned from the Senate hearing. We're joined by Dr. Ashish Jha, director of the Harvard Global Health Institute. Thanks so much for being with us. So Dr. Fauci warned today of the real risk of triggering an outbreak you can't control by reopening too quickly. But isn't that what we're risking doing?
Absolutely, and thank you for having me on. What Dr. Fauci said today is really try to convey to senators and really the whole country the science and evidence behind where we are. The White House has laid out guidelines for when states can safely reopen. And the truth is that many states are not adhering to those guidelines. And the president is not adhering to those guidelines that he himself has set out. And what Dr. Fauci said was he laid out the consequences of not following the science and evidence here.
It's quite staggering when you put it like that. We heard today about the need for timely testing. 400,000 tests were conducted yesterday. Is that close to being enough?
Unfortunately, it is not. And it is an improvement from where America was a few weeks ago. And I think we should take some amount of comfort in that. But we now have the largest outbreak in the world. We have many, many thousands of Americans getting infected every day. And the truth is that the amount of testing we have is not enough to really put our arms around the size of this outbreak and identify most of the people who are infected. So we have estimated that we probably need closer to 900,000 or 1 million tests a day if we're going to get this disease under control.
We also heard today that contact tracing is critical. What's the state of contact tracing right now in America?
Yeah, this is so frustrating. We know how to control this disease. We've known for months that you have to do testing, you have to do contact tracing, you have to do isolation. This is outbreak 101. And we have, instead of working on developing a national contact tracing strategy and helping states really build out their program, we've wasted the last 2 months. And so some states are doing it on their own. Massachusetts, where I am, has got quite a good program. There are a few other states that are pretty far along, but a vast majority of states have little to nothing going on around contact tracing. And that's a real problem.
And Dr. Fauci also said today that the real death toll from coronavirus is likely higher than 81,000. Why is that?
Yeah, what we've seen in study after study is that there are a lot of people dying at home at much higher numbers than usually die at home in any given time period. And we think a lot of that is from people dying of COVID, but not coming in, not getting tested. And so, unfortunately, and we've seen this in the UK, we've seen this in other places as well. And so I think all of us believe that the number of people who've died of coronavirus is substantially higher than the official count of 81,000.
Are you expecting then a second wave of infections here that maybe collides with the flu outbreak?
So a lot of it depends on what happens over the summer. If we can keep the disease under reasonable control over the summer, have good testing, make sure that people maintain a certain amount of social distancing, I think we can get through the summer. But there is no doubt that if we do that, we're going to have a very large outbreak in the fall. And with the fall will come the flu, as you said, and that'll fill up hospitals. Combine that with coronavirus, and we may be heading towards a very difficult fall and winter ahead.
Dr. Ashish Jha, thank you for being with us with that sobering analysis.
Thank you for having me on.
Well, for more on